Hey there, I'm Dr. Shannon Gregoire, and I want to welcome you to another episode of Vet Candy Rounds. Today, we're diving into the case of the lame Labrador. Let's break it down. So, picture this. A 9-year-old male Labrador rolls into your clinic because he's been low-key lazy and showing hind limb lameness. First things first, we bust out a physical exam and get the scoop from the pet parent. He's got normal vitals, but he's packing some extra pounds with a body score of 8 out of 9. Now let's bring in the expert, Dr. Philippa Pavia, a veterinary surgeon, to share some knowledge on how to handle this situation.
I'm Philippa Pavia, a board-certified veterinary surgeon. Thank you so much for pulling me into this stat chat. We can talk a lot about osteoarthritis. So, even when a dog like this, a 9-year-old, large breed, Labrador, overweight dog with a hind limb lameness comes in and screams arthritis to you, we still have to be systematic in our approach. Can't miss the forest for the trees. Still have to think about everything step by step. History, clinical presentation, progression of signs, that can be really important. Any response to therapy that the dog's already had. Then, of course, your physical exam, your gait evaluation, and then, and only then, are you going to start thinking about diagnostic tests, like blood work or radiographs. All right, I've got my history, I've got my signs and my progression, and I've done my physical exam, and this dog, indeed, is limping on one of his back legs, his right hind limb, for example. But I still want to make sure that I'm ruling out any non-orthopedic cause of lameness. That could be neurological disease. So, large breed, older dog, lumbosacral disease, or other intervertebral disc disease. Any sort of cancer or neoplasia, gotta have it on your rule-out list. Or how about another systemic disease, abdominal pain, some other reason why he may not be walking normally. Once I've gotten through that, then I can focus on where in the limb is this pain coming from. I personally like to start from bottom to top. I like to start with the toes, the long bones, the ankle, make sure that we're not missing any of those less common sites of joint pain. Then the knee or the stifle and the hip joint, those are definitely going to be our most common sources of lameness in this dog breed. So now I've ruled out other causes of this lameness. No neurological or other systemic disease that I can think of. Ideally, if a dog's already come to me from a primary vet, maybe they've already had blood work and I know that their liver and kidney values and all other blood work is normal. That would be great. Doesn't always happen. Sometimes I'll do that myself before I move to the next step. On my physical exam, I'll want to also be systematic and go joint by joint, making sure that there's no instability or any other reason for this dog's lameness. So I've localized the dog's pain. It's his hip that's hurting. I know that his knee isn't unstable, he doesn't have an ACL tear or something else that may be a surgical illness, but he's got pain in his hip. Now I can start thinking about confirming the source of that pain, and I might want to take my x-rays now. I've got my x-rays back, and now I know this dog has hip arthritis. Most likely, both of his hips aren't normal on my x-rays, but he's only limping on his right hind leg. That's pretty common for a dog to have arthritis in both joints, but really only be limping on one. One thing we need to think about is that arthritis isn't just a static disease. There's often a baseline level of inflammation, and then something happens. Sometimes we know what it is and sometimes we don't. That raises that level of inflammation and it flares up. So that hip, the right hip, is the one that's hurting, even though they might not be normal on either side. So what do we do about it? We have our confirmation, we know that we don't need to do surgery, which is a good thing in most people's book, even if it isn't in mine. So next step, we're going to think about medical therapy, and we're also going to think about physical therapy. Things that we can do. We know this dog is overweight. There's some pretty good studies suggesting that weight loss is one of the best ways to slow the progression of arthritis. So we'll have to have that tough talk with the owner about weight loss. Other things that we can do in the short term would be an anti-inflammatory medication. I say short term because we don't want our pets or our clients' pets to be on these medications for the long term because they can have a negative effect on the internal organs if there's an underlying disease process. Other medications that we could use, things like gabapentin or amantadine. These are pretty safe medications that can be used for chronic joint pain like osteoarthritis. Other things that we definitely want to reach for would be supplements. Every dog is different. Some dogs respond really dramatically to supplements, and other dogs, it's just a really nice basis to support their joint health. Elements of these supplements can be anywhere from your basic glucosamine and chondroitin to extract of green-lipped mussels, other types of nutraceuticals. There's a whole world out there of nutraceuticals that you can look into. Then there's other things that are a little bit outside the box, like platelet-rich plasma injections, or even stem cell therapy is coming to the forefront in veterinary care as well. Maybe not something that you'll be reaching to in the first step, but things you can definitely talk about with the owner. Okay, I just gave you a whole list of things you could do, but what would I do with this case? A bunch of things. First steps, and then long-term care and management. First thing, exercise restriction and an NSAID. I usually do that for about 2 weeks. That's because I want to take that inflammation, that arthritis. What is arthritis? It's just inflammation in the joint. I want to take that inflammation from here to here. I can't bring it back down to normal, but this dog's been walking around with arthritis for a while and he's been tolerating it until this most recent flare-up. So rest in an anti-inflammatory, usually for 2 weeks. If I think this dog's arthritis is bad enough, I might even start them on a long-term therapy like gabapentin or amantadine while I'm doing this initial therapy to have something to keep them steady and to keep them feeling better even when we have to wean those anti-inflammatories off. Then I'm going to calculate their ideal caloric requirement. I'm going to recommend that they bring that caloric intake down and get the dog to a healthier weight. If they can, and if you're in an area that has access to physical therapy and there are board-certified canine rehabilitation therapists, I'll sometimes recommend that these guys do see a physical therapist because they can help with weight loss, they can help with mobility, and they can help with maintaining that muscle strength that supports an unhealthy joint. If you have any specific questions for me, you can put them in the comments below, or you can reach out to me on LinkedIn.
That was some solid advice from Dr. Philippa. It's always great to have experts weigh in on these cases. Thanks for watching Vet Candy Rounds. If you enjoyed this episode, be sure to spread the word with your friends. Sharing is caring. Bye!
When you talk to clients about parasites, recommend this parasiticide from Boehringer Ingelheim Animal Health. NexGard Plus is the one you want for one-and-done monthly protection. It prevents heartworm disease, kills fleas and ticks, and treats and controls roundworms and hookworms. Plus, the delicious beef-flavored soft chew is safe for puppies. Use with caution in dogs with a history of seizures or neurologic disorders. Give your clients one-and-done monthly protection with NexGard Plus.